Hi, my name is Linda. I'm a nurse practitioner. I've been treating Hep C patients for over 10 years, and I've been treating HIV patients for over 15 years. Today, I want to teach you how easy it is to cure hepatitis C. We've been curing hepatitis C now for at least the last 10 years since the pills came out. And today we have two pills that we use almost exclusively just because of the deal they made with the insurance company. And you can cure hepatitis C in 8 weeks or 12 weeks, just depending on what your insurance requires you to use. And if you don't have insurance, you're completely uninsured, both drug companies will give the medications for free. You just need to have some of the blood tests done at a provider's office, and it's that simple. The first test you need done is a fibrosis test. And that comes back, it's reported as F0, meaning no fibrosis, or F1, 2, 3, or 4. Usually if they're an F4, I do send them for an ultrasound, but I do not hold treatment waiting on the ultrasound. I'm really just checking on an F4 just to make sure they don't have liver cancer at this point. But you still would treat the patient. And that's really all that fibrosis test is going to tell us. The next test, we want to get the hepatitis C quantitative, and we want to reflex that to genotype. We want to know the viral load, and it doesn't matter if their viral load is 5,000 or 50 million. It's the same medication and it's the same treatment. These are just things that are required by the insurance company to prove, I guess, that you have Hep C. And there are 6 genotypes, and that's just reported as a 1A or a 1B, 2, 3, 4, 5, 6. And again, it doesn't matter which genotype you have, both medications will cure all 6 genotypes. Again, insurance requires it. You need an HIV antibody test. If you have HIV, you have to be currently in care. We want your HIV to be under control before we start Hep C treatment, or you can start both at the same time. You also need to know the hepatitis B antigen. Sometimes I just run the whole hepatitis B profile, but you definitely need the hepatitis B antigen. If they are hepatitis B antigen positive, then they probably would need to be on treatment for hepatitis B because the medications for Hep C can exacerbate a Hep B antigen positive patient. I talked about the HIV. You also need a PT-INR. You need an AST and an ALT. I usually just order a CMP to get the whole panel. You need the platelets. I usually just order a CBC with diff. And if they're of childbearing age, a woman has to have a pregnancy test, and I usually just do a urine pregnancy test. When it comes to the AST and the ALT, I have treated patients with those numbers well over 400, and they have done just fine on the medication. You're only not a candidate for hepatitis C treatment if you have ascites or if you ever have had a paracentesis. If you've ever had a paracentesis, you need to be referred to hepatology. If you give the patient medications and they have had a paracentesis, they're already in liver failure and you can make them very ill, if not kill them. So I do not treat patients with a paracentesis. I refer all of them to hepatology, and usually they're referred to the transplant list. And you also cannot be pregnant because none of these medications have been tested in pregnancy. The 2 drugs that we use, one is called Mavyret and one is called Epclusa. Mavyret are 3 pills that you take all at the same time every day for 8 weeks. Epclusa is 1 pill once a day for 12 weeks. I usually ask the patient, or how do you feel about taking pills? Do you mind taking 3 at one time every day, or do you just prefer 1 a day? And then I also tell them it also depends on your insurance company, which one they have made the deal with, because this is a $25,000 to $30,000 treatment. So they have to have a good buy-in. If you don't have insurance, Mavyret, their drug company is called AbbVie, and they do have an AbbVie patient assistance program to get the drugs for free. And Epclusa is made by Gilead, and Gilead also has a patient assistance program to get the medications for free. After they've completed treatment, I usually have them come back to get 1 more viral load just to make sure their viral load is undetected. And it's that simple. The guidelines have changed a little bit, and I guess everybody's getting a little more flexible since we've been at this now for 10 years. We used to make people come back in 4 weeks for a new viral load, and then at the end of treatment, and then 12 weeks and 24 weeks post-treatment, but not anymore. Really, we haven't seen people becoming reinfected, or should I say not reinfected, but also having their virus come back. Usually I've ever seen the virus come back if the patient admits to getting reinfected. They've restarted drug use, IV drug use. Usually is the only reason I've ever seen for the virus to come back. If you do have the virus come back, then we have to do more testing to make sure you don't have resistance to the medication we've given you in the past, but we do retreat people that have had hepatitis C in the past. We don't want hepatitis C to turn into liver cancer one day. Well, I hope I made that super easy for you. If you have any questions, leave them in the comments. I'd be glad to answer them for you. And let's keep curing everyone.